Hey everyone, and welcome back to the channel. I'm Joshua, and today we're diving deep into lower limb anatomy. This intricate system of bones, muscles, nerves, and blood vessels allows us to stand, walk, run, and jump. I've put together a 10-question quiz designed to test your knowledge and maybe even teach you a few new things. Don't worry if you're not an expert. The goal here is to learn and have some fun. Ready to put your anatomy knowledge to the test? Grab a pen and paper if you want to keep score, and let's see if you can ace this lower limb anatomy quiz. Let's get started with question number 1. Alright, kicking things off with our very first question. Which nerve innervates the muscles of the anterior compartment of the thigh? Take a moment to think. If you said the femoral nerve, then congratulations, you've nailed the first question. The femoral nerve supplies the anterior thigh muscles. These include the quadriceps and sartorius. They extend the knee and flex the hip. Without it, these actions are compromised. Moving on to question number 2. Which muscle is a powerful extensor of the hip and is innervated by the inferior gluteal nerve? The answer is the gluteus maximus. The gluteus maximus is the largest and most superficial of the 3 gluteal muscles. It's crucial for powerful hip extension, like standing up or climbing. The inferior gluteal nerve innervates the gluteus maximus. It's essential for sprinting or jumping. Weakness can hinder these actions. Understanding this is vital for kinesiology and physical therapy. It impacts rehabilitation and performance enhancement. Let's tackle question number 3. Damage to the common fibular peroneal nerve at the fibular neck most likely results in. The correct answer is foot drop, inability to dorsiflex and avert the foot. The common fibular nerve is particularly vulnerable to injury as it winds superficially around the neck of the fibula. This nerve divides into the superficial and deep fibular nerves. The deep fibular nerve innervates the muscles responsible for dorsiflexion, while the superficial fibular nerve supplies the muscles responsible for eversion. Damage to the common fibular nerve will compromise both dorsiflexion and eversion. Patients with foot drop often exhibit a characteristic step-page gait. Early recognition and management of common fibular nerve palsy can significantly impact a patient's recovery. On to question number 4. Which structure passes through the greater sciatic foramen below the piriformis muscle? The answer is the sciatic nerve. The greater sciatic foramen is a large opening in the posterior aspect of the pelvis. The piriformis muscle passes directly through this foramen, dividing it into suprapiriform and infrapiriform spaces. The sciatic nerve typically exits the pelvis by passing through the greater sciatic foramen inferior to the piriformis muscle. Alongside the sciatic nerve, you'll also find other important structures like the inferior gluteal nerve and artery. Understanding this anatomical relationship is important, especially when considering conditions like piriformis syndrome. Knowing the precise route of these structures helps in differential diagnosis and treatment planning. Dictates the type of surgical intervention chosen for a femoral neck fracture. Question 6. Which muscle is involved in both hip flexion and knee extension? The answer is the rectus femoris. This muscle is unique among the quadriceps group because of its origin point, allowing it to act on both the hip and knee joints. The rectus femoris originates from the anterior inferior iliac spine and the ilium just superior to the acetabulum. It then runs down the thigh and inserts into the patella via the quadriceps tendon. This dual-action capability makes the rectus femoris important in activities that combine hip flexion and knee extension. Understanding the biomechanics of two-joint muscles like the rectus femoris is crucial in fields like sports medicine and physical therapy. Question 7. A positive Trendelenburg sign indicates weakness of which muscle group? The answer is weakness of the hip abductors, specifically the gluteus medius and gluteus minimus muscles of the standing leg. The Trendelenburg sign is an important indicator of hip abductor function. When a person stands on one leg, the gluteus medius and minimus muscles on the stance leg contract to prevent the opposite side of the pelvis from dropping. If these muscles are weak, the pelvis on the unsupported side will drop. This observable pelvic drop is the positive Trendelenburg sign. Recognizing this sign is key for diagnosing underlying hip pathology. It guides rehabilitation efforts focused on strengthening these critical pelvic stabilizers. Question 8. Which ligament prevents anterior displacement of the tibia on the femur? The answer is the anterior cruciate ligament, or ACL. The ACL prevents the tibia from sliding too far forward. ACL injuries are common in sports with sudden stops and changes in direction. Question 9. Which muscle is located in the lateral compartment of the leg? The answer is the fibularis longus, also known as peroneus longus. The lateral compartment contains the fibularis longus and fibularis brevis muscles. These muscles evert the foot and assist in plantar flexion. Final question. The tarsal tunnel is found on which side of the ankle? The answer is the medial side of the ankle. The tarsal tunnel is a fibro-osseous canal located on the posteromedial aspect of the ankle. The roof of the tarsal tunnel is formed by the flexor retinaculum. Several important structures pass through this tunnel, including the tibial nerve. Compression of the tibial nerve within the tarsal tunnel leads to tarsal tunnel syndrome. Symptoms can include pain, numbness, and paresthesias along the sole of the foot. Understanding the location and contents of the tarsal tunnel is crucial for diagnosing and managing conditions affecting the nerves and tendons that pass through it. And that's a wrap on our lower limb anatomy quiz. How did you do? Comment your score down below. Challenge a friend or a classmate to see if they can beat your score. I hope you found this quiz engaging and educational. Whether you got 10 out of 10 or just learned something new, you've invested time in understanding yourself better. If you enjoyed this quiz, hit that like button, subscribe to the channel, and turn on notifications for future videos. Thanks for joining me today. Stay curious and I'll see you in the next video.